A report due to be launched this week by disability advocacy organisation Inclusion London affirms the fear many disabled people have experienced throughout the pandemic over being denied life-saving treatment should they become seriously ill with coronavirus. In the report entitled, Abandoned, Forgotten and Ignored, the Impact of COVID-19 on Disabled People, several survey respondents attested to being pressured by their doctor to have DNR, or do not attempt cardiopulmonary resuscitation orders placed on their medical records. This is further supported by research carried out last month by disability charity Scope, which found that 63% of disabled people feared they would not receive the treatment they needed if they were hospitalized due to coronavirus. A more insidious practice has also been brought to light in which some doctors have been placing unlawful DNR orders on the records of individuals with learning disabilities without prior consultation with the person's family or carers. Turning Point, a social enterprise providing health and social care services across over 300 locations in the UK, along with Learning Disability England, responded earlier this month by producing a new information pack to educate parents and carers about DNR orders and the steps they can take to challenge them. Turning Point has seen a total of 22 such orders since April requiring immediate challenge. Over the same period, Learning Disability England has observed 20% of its member organisations reporting doctors placing DNR orders on the records of individuals they represent. Announcing the new guide, Julie Bass, chief executive at Turning Point, said, "It is not only illegal but outrageous that a doctor would decide not to save someone just because they have a learning disability. They have the same right to life as anyone else." In the U.S., several states including Tennessee, Washington, Kansas, Pennsylvania and New York have issued protocols deprioritizing the treatment of disabled people in the event of scarce medical resources. Additionally, Alabama was compelled in April by the Office for Civil Rights to abandon its crisis management policy of denying ventilator services to individuals based on the presence of intellectual disabilities, including profound mental retardation and moderate to severe dementia. In the UK, the government has come out very strongly against the use of blanket DNRs for certain patient segments. However, despite criticism from opposition parties, it has resisted publishing national guidelines, instead preferring to rely on the judgment of the medics on the ground. It is in this space that whispers of ruthless medical utilitarianism and Nazi-era eugenics began to surface within disability communities. Ideas around eugenics or selective breeding emerged during the early 20th century and became a key component of the master race ideology. The Nazis dismissed disabled people as useless eaters and a drain on society.